So today I will discuss clinical and pathological findings in fatal cases of severe fever with thrombocytopenia syndrome with high viremia in cats. This paper is out of Japan from 2022. It is not open source, so I will just go through my takeaways from the article. There are impressive images, so if you are able to access the images, please take a look. This is only a disease of concern in East Asia at this time, so it will not be something for you to know for boards. However, as I went through this article, I might as well discuss it. Feel free to skip to another video, however, if this is not going to be helpful for you. So severe fever with thrombocytopenia syndrome, or SFTS, is an emerging zoonotic disease caused by the SFTS virus. So the SFTS virus causes severe symptoms both in humans and cats. SFTS was first identified in 2011 in China and is currently endemic in Eastern Asian countries. In people, mortality is reported as high as 30%, but in cats it's reported to be as high as 60%. It is thought to be transmitted by ticks. The amblyoma was found in one of these cats in this study and was found to have the virus within it, so the amblyoma at least seems like a probable cause for this being a transmitter in cats. In this study, they reported the clinical and pathological findings in 4 fatal cases of cats with high SFTS viremia levels, as indicated by the title. All cats died within 5 days of presentation, which is pretty crazy how things progressed in these patients. These cats showed an acute onset of fever, leukemia, thrombocytopenia, with most being less than 10,000, although one was closer to 70,000. And they also had increased amyloid A and pro-inflammatory cytokine levels. A high viral copy number was detected in the blood, oral swabs, rectal swabs, conjunctiva swabs, and urine. Histopathologically, necrotizing lymphadenitis, splenitis, and lymphoblastoid cell proliferation and hemophagocytosis were observed in 4 cats. Immunohistochemistry revealed the presence of SFTS viral antigen and lymphoblastoid B cells. SFTS viral RNA was detected in systemic tissues, including the brain, although none of the cats had gross CNS lesions. The present findings provide useful information for understanding the features of fatal SFTS in cats. To elucidate the mechanism of severe progress of SFTS cats, as well as the role of the source of human infection, further research is still needed. A couple of things to add from this discussion. 2 of the cats were positive for FIV and no ticks were found on those cats, so it is theoretically possible that subsequent additional exposure of cat-to-cat interaction outdoors could have occurred and resulted from the transmission of the SFTS virus. Additionally, there is a paper by Suzuki et al. Suggesting that during the end stage of SFTS, at least in humans, differentiating B cells and secondary lymphoid organs are the primary target of the virus. It has been suggested that patients fail to establish the IgG antibody response because of the disruption in the B cell mediated humoral immunity, and some of these cats were not positive for the IgG, so this could be a reason why, but obviously more research is still needed on that. All cats did present with icterus, which is thought related to hemolysis, as liver values appeared normal in all of these cats, and hemophagocytosis was observed in all cats, but it is uncertain if this is truly the case. One cat had seizures and another had an obtundant mentation. However, the cause of this is unknown, as there were no gross lesions. In human SFTS lethal patients, CNS manifestation includes dizziness, headaches, encephalitis, and coma, and they're all risk factors for a fatal outcome. The deterioration of consciousness and other CNS-associated symptoms that appear from the severely ill SFTS patients are thought to be a result of a cytokine storm. Overall, this is an interesting paper, and I'm glad that we currently don't have this here in the United States, but given what has happened in recent history, it is always good to have some idea of some of these diseases in the back of our mind. It is frightening to think that this could be transmitted from cat to person, but more research is still needed on this. Obviously, this is not anything I'm familiar with, so I don't really have much to add from a personal level. There is more information about the cytokine evaluation in this paper, but I really just wanted to do a brief exposure of this disease this virus for those not familiar with it. That is all I have. Thank you for your time.